usually after one treatment, like I had a client I hadn't seen for about 4 years, and she came for a first treatment, and when she came back for a second, so you can feel there's just a lot of congestion here.
It's because you ate those tomatoes.
I don't know if I want to say that on TV right now. But yeah, I have issues.
Yeah. So I'm going to spend a little bit of time on this area here. So this is around the sternochyli, what they call. So everything from the lower extremities comes up into here, comes up through the thoracic duct and into this terminus up here. Do you explain about the
Thoracic duct.
they what? The flow in terms of which sides?
Yeah, what comes to the
Yeah. So this left side here does a huge job. So if I just running over here, see that's actually going, but it's just you can't even hear it. It's really sluggish. Oh, did you hear that? Mm-hmm. Yes. Yes.
What did you hear?
Don't ask.
No, it's good.
We're all like, what?
It was a bubble noise.
What?
It's not gas, but it's bubble.
So it's clearing the,
Yeah.
obviously giving the means it's clearing. Congestion coming another smell.
So
No. Oh my gosh.
So the arm and the right side and the head, all that part there comes into the right terminus, and the rest of the body and the left side comes into the.
see that is going. You can see the colour, but if I take my hand away, it looks like it's not going, but it's really quiet because you've got a lot of stuff here. So you know, and this is why you need several appointments before we even get going, really, because this might be it, you know, in terms of a new client or something, and then they go, well, what have you done today? But to me, hearing that little gurgle was really nice.
You got very excited.
I did. This is really exciting. Have I got any more in there? There's a lot of...
Yeah, there was one more section under treatment.
Yeah, and then there's all of that stuff as well if you're interested in more.
So read this section out.
Yep.
Okay, rate control. Always set to number 5 when starting. This is the setting used most often for general therapy. The lower the number, the slower the rate. This would make the therapy more soothing or relaxing, better for the highly toxic person. One would gradually increase the speed over several TX.
Treatment.
Oh, of course.
Sorry. Sorry.
I know. For the first few treatments, it is advised to be more conservative and use the slower settings. The higher number, the more highly compressed rate. This is more stimulating, more concentrated, and working at a deeper level. Good for breaking up deeply congested areas. Bulb color. Touch transmission head, the bulb to the skin. Turn the dial a bit and observe the color of ultra blue when touching with your finger. The intensity of the glow will vary when removing from the skin. The color of the bulb is determined by the mix of the gases. Ready for treatment. The bulb should glide gently along the skin with no pressure necessary. A tickling sound should be heard when the bulb is placed on the skin. This will vary with the settings of the dials.
I'll just hang on for a minute there. So I'm just going to do a little bit of manual. So you good at abdominal breathing?
Yes.
Yeah, so I'll get you to take a nice deep breath in. Oh, hang on, wait, just put this back here. Okay, take a deep breath in and let it go when you're ready. And again. And let it go. And one more time. And let it go. So again, using this machine, it can penetrate a bit deeper than I can physically, so it's particularly good over the bony parts. So working with the liver and the spleen and the stomach and all of that kind of stuff. So I would, for a new client, I probably wouldn't be getting down to your legs, and I would have to explain that, and they get a bit disappointed because you can't really feel what I'm doing. You think, what am I doing? What's she doing?
Often they say that.
So it's quite frustrating because you feel like you're having to sell yourself a little bit. But anyway, going back to this client, she came in the second time. She goes, oh well, I didn't feel it. Nothing's changed. And anyway, so we got onto the second treatment, and things were clearing a lot better. And yeah, and when she finished, because she's got a problem with her left leg, I said, how does your shoe feel? And she goes, oh, I can do my zip up. She couldn't do her zip up when she arrived on a shoe. So those are just little subtle things that happens. And like with the woman with breast problems, it's like, oh, well, how does your bra feel? Oh, oh.
It's not until you say that too. It's not until you say that.
Yeah,
And
yeah.
then they realise.
How long is it between treatments, like for an initial client?
Well, ideally, it would be good to see somebody twice a week initially, but I mean, it's a lot of money as well and time. So once a week over the first 3 weeks is ideal, and then, as I said, we reassess.
Would you do like a combined session of this and massage, or would that be dangerous, or
No, I wouldn't.
too much flow?
Well, no, it's just because the superficial lymph is just beneath the skin. So if you're pressing too hard, then you're going beyond the lymph. I'm just going to take that up a little bit higher.
What would be a safe precautionary time between this and a massage? So if someone was booked to have both in a week, is that possible, or would we steer clear of
I
it?
think so. Yeah.
Is it like sort of a day between, or 3 days between, sort of?
I would think 3. Would you?
That's the same option. And as I said, it's about creating a rhythm and stuff. Look what Raewyn's doing. She's creating a rhythm with her own body. She's moving.
So she's really, Tori, you're really, really congested in this area, and this is a really important thing for you is to maybe work. So this is the solar plexus area as well, and where we carry a lot of stress, nervousness, and all of that kind of stuff. So this area really needs to be a lot clearer to get any movement from the lower extremities. So self-care is you can just do some gentle massage in through there, and also abdominal breathing.
So because you agreed for 3 days for massage, would there be anything wrong with someone like going from one of these sessions and then like going for a run or something?
No.
Would you wait, or no? Doesn't matter?
It really I think it just depends. It's quite surprising how people feel. Some people feel absolutely knackered when they get off the table, and then they feel a bit energized later. Some people feel differently. It's just a little bit like massage. You can feel absolutely thrashed or whatever. It really just depends how you are, and it's really important to keep hydrated as well. So the effects of the treatment will continue for several hours post. So I'm working over her liver area here, and it's all what we call sticky.
Is it related to the same area here, or is that different again?
Yeah, all of this sort of gut area.
Is that dietary, or is it as well, or?
What kind of medications are you on?
I'm not doing any medication because he wanted me to be on, I don't know what it is now.
Prednisone?
Prednisone full
Right.
time, and I didn't want to be on prednisone, so I've just gone and I've changed and gone to paleo because my
Okay.
rheumatologist said that to try that.
Have you heard of the Patterson program?
No.
Have a look at that. I have a friend who's totally off all her meds. Oh, she's a bit older than me, and she was on prednisone and methotrexate and all sorts of things for a long, long time, and she's off all of her meds now.
That's good.
Yeah. And yeah, she's doing a lot better. So it's a bit like watching paint dry. I mean, if she wasn't, Tori wasn't so congested, you know, we would be zipping off down here, but she is. So what I might do is just work on your bowel area as well. So if you can just raise your both knees slightly. Okay, and you talked about the iliac?
No,
No? Okay, just pop your...
just did the gentle and stuff. You
Yeah.
and that you did it.
So in the iliac crest here, there's a bunch of lymph nodes that are really, really important. Is that okay?
We talked about the Raewyn, didn't we?
Yeah.
Show the wheel was.
So if you flip a few pages, there's a diagram of the gut area, and it says something about the iliac where they drain. If you look at the, go back, go back.
Was one of these ones?
Yeah, if you go to the other page, there, no, the next to it.
Oh, this one here.
Yeah, is there an iliac there?
Celiac, gastric, hepatic.
Oh, I think you're on the visceral.
No.
Might be on that one.
Yes. Internal iliac, common iliac, external iliac.
Yeah, so if you can just read where they drain.
Okay, external iliac. Arrange the bowel external iliac vessels. They drain the deep lymphatics of the abdominal wall below umbilicus adductor region of the thigh, urinary bladder, prostate gland, ductus deferens. Sorry if I'm pronouncing these wrong.
Oh, I wouldn't have a clue either.
Yeah, seminal vesicles, prostatic and
Okay.
membranous
Optimus,
urethra,
Do you mind if I just borrow your knickers to use this?
uterine tubes, uterus and vagina. Common iliac, arranged along the course of common iliac vessels, they drain pelvic viscera. Internal iliac, near the internal iliac artery, they drain pelvic viscera, perineum, gluteal region, and posterior surface of the thigh. There's also sacral and lumbar.
Yeah, that's fine. So I'm parking this transmission here using her knickers in the iliac region, and then I'm just going to work on the descending colon.
Get it right.
Yeah, get it right. So when I did this course, obviously we did it over 3 days, I think, and I think by day 3, I think we just about cleaned the place out with loo paper, but it took that long to sort of, you know, and that was every day.
Do you practice on each other or other?
We worked on each other, yeah. So note how I'm grounding myself to her as well.
Is it a good thing that it's making a lot of noise there?
It's a good thing, but you still, I mean, that should glide quite nice. That should glide. I mean, normally, say somebody would have areas of the gut that are congested, you know, like pockets of congestion.
So you'll know that you're finished in an area once it's just gliding fine, or?
Yeah, I mean, I will work a gut because something is better than nothing, but ideally you'd want that to be a little bit more smoother. So, you know, this kind of work, if you love your deep tissue stuff and kind of like a person that is on a go, 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 it may not suit you. But I just think the lymphatic system is just fascinating. It was like when I was studying, it was kind of like as soon as we did the lymphatics and anatomy and physiology, it was just like, whoa, this is so cool. I really loved it.
Just trying to think back to last year. I don't think we did a huge amount on lymph, did we? We did it, but it was not.
a huge test, and we had a few classes before.
Was it combined with something?
No, we had the lymph was its own section because it was so big.
I do not remember.
It should have been a separate section.
Yeah, it
also,
was.
to understand it.
I just can't remember.
Because yeah, we did cardiovascular and then we did lymphatic, so it runs alongside it.
Is it like all the organelle things? That one?
Like all the
I'm just trying to think of.
macrophages and all that
Yeah,
sorts of
yeah,
things.
no, I do remember it now actually. That sucked. That was hard.
It was a tough one. It was real tough.
We were in lockdown then.
No.
No.
No, I remember you guys.
We were doing
downstairs, and then I
lab,
came down,
yeah.
and we were all in the corridor there, and Amy had you drawing. Did you do the lymph system or whatever? You were doing that.
Maybe I was. Maybe that's when my kids had COVID. Because I did so much all over my windows.
That's fine. Yeah, because you set your exam a little bit after us.
Yeah.
So now we're coming across the transverse colon.
Because that's the way it goes, ascending, transverse, descending.
Yeah.
So she's, unlock the descending.
Do you always go descending first and then
Yeah,
transverse?
yeah. So with lymphatic as well as like if you're working on the gut anyway, massage wise, you'd want to clear where it's going. And reflexology, if anyone's done that, you want to clear. You make a space for
pathway.
everything to come into.
Flow into.
Yeah. So, you know, even today, while we don't work the legs, if we work this area well, we're creating space for the fluid to move into.
I'm curious, how much of a change have you noticed from people who've had COVID versus?
I've actually only done one person, but she was very, very fatigued. But by the time I saw her, she was feeling quite fine. But apparently, I would imagine that this would be really, really great.
I have a question, but I'm not entirely sure how to form it, so I'll just
Okay.
verbal diarrhea.
Yeah.
When I did my diploma of beauty, we had to do basically like a similar thing with a similar machine,
Okay.
and the client held on to the electrodes and
Okay.
we massaged them and kept in contact because it provided a deeper massage with the current going through both our bodies.
Right.
Is there much difference doing this if you were doing the massage that way? I'm sorry.
No, because I believe like we would spark. Like I need to be
Yeah,
connected.
you don't lose contact. You keep in
Oh,
contact the
okay.
whole time.
Yeah. Well, I mean, I could get her to hold a head.
Would that do that same thing versus moving the electrode around?
I don't know.
Sorry for the questions.
No, that's all right. I don't know.
Would there be a client that you would not do this on?
Yeah, I mean, obviously you've got your contraindications like, you know, congestive heart failure and all of that kind of stuff.
So what are other contraindications that you would not do this on?
I think I gave you that one.
Yeah, I don't know, can't remember at the top of my head, but
Basically, anyone who doesn't like electricity going through their body.
I mean, and pregnancy, obviously, you can't really work this area with the machine. So yeah, self-massage on your gut area would be useful as well. Where's your last bell?
I don't know. Yesterday, I don't know.
Oh, okay. So any toxins that we're stimulating will get removed either through the skin or the bowel motion or through your urine. Okay, so we're coming up the ascending colon. So you've got about 75% of your lymphatics in your gut area, so this is a really important area to work.
How busy are you with this?
I'm not very busy at all with anything, to be honest, at the moment. The last 2 years have been a bit weird.
But before that, I haven't been able to get into it.
Yeah, I was really busy. But like I've moved house, COVID's hit. Like I moved from Hamilton to Cambridge, so I've been off work as well myself. So yeah, I'm kind of like rebuilding.
But it is something that would get fully booked out pretty quickly, or?
I think it depends on what contacts you've got as well with referrals. I used to get a lot of referrals from Steve Joe, who's a what would you call him? What are they called? He's a GP, but he's now a alternative kind of
holistic.
Naturopath.
Yeah.
No,
It's a bit like Bill Reader. Both of them are.
yeah. So and Renee.
What he himself calls the dark side. The GP's like there, and they sort of call him that he's on the dark side because he looks at, looking at all the supplements.
The whole body, basically,
And looking
holistically.
at you without, the standard medications, looking at alternative medications that are not going to affect the body. And he does that.
medications.
Yeah, through that. And he said that's when he first started, that was the thing he was classed. He was ostracised by the rest of the GPs and stuff.
Yeah.
And he said, and that's how he turned himself. I come from the dark side.
Yeah. I mean, I think it's also your intention as well, because I don't know, things in my life have changed quite a lot over the last 2 years as well, circumstances, and I think you kind of put out that energy. So like I'm feeling like I'm ready to get back into business kind of now, and things are picking up. So it's, I don't know, what you put out to the universe, really, I suppose, in an odd way.
So my mum, who's got obviously lymphoma in her arm where it's all swollen.
Lymphedema?
Yeah.
Yeah.
When you're doing this on her, would you go right up and down the arm, or would you just stay in the certain spots?
Again, you have to clear, because it's very specific, you have to work sort of proximal to distal, and then maybe do an effleurage up through there. So it's very different to massage. Like a lot of people call it massage, but it's not a massage. It's very specific to what you find in the body and the way the body flows and works.
Because before she had the trial surgery to put lymph nodes there.
Oh, did she?
Yeah,
Okay.
so that's what she's going through at the moment.
Okay, cool.
But obviously before that she had none, and that's why she's got the lymphedema. So how would you? Yeah.
She sometimes they say they've got none, but they may still have even one lymph node. So you'd still work that same area, like all around the breast. So you've got your pectoral nodes through here. So like if anybody's wearing underwire bras, you're doing yourself a little bit of a disservice, because any constriction is blocking that lymph flow. What? Are you wearing it? Oh well.
How about your
Oh, I
boobs?
was just thinking a disservice. I was like, no, it's a service for everyone not to see my
Okay,
boobs and
sorry.
my knees.
That's a bad word to use. Sorry, I apologise. Me with the small boobs.
So would it be safe to say that a golden rule with this is to always clear where it goes
Yes.
last and then work your way further away from the end?
So good time. This is a good time of year. So like with autumn, you've got the drain. Okay. So these areas are the drains. Okay. So you want to clear those leaves away. So if you brushed all of that flood to where those leaves are, that drain, it's not going to go anywhere because it's all blocked, right? So you've got to unblock, and then send the fluid.
So it's always quite systematic then.
It's
really,
very
isn't it?
systematic.
Yeah.
Very systematic. Okay, so going to work the small intestines now. So ladies that I've treated with, that have had chemo, radiation and all of that kind of stuff, we do get that metallic smell quite a lot off them, and they can quite often taste it. And it could be, that was another little gurgle. Hey?
And why do they get a metallic? What is a metallic?
I think it's just the toxins of the byproduct of the treatments are just coming out of their skin, and yeah, they can just taste it. I've had one lady who actually, like when I was working on this area, the Cisternochyli, it smelled like rotten cabbage actually, and she felt really crap after the treatment.
So I'm guessing since you're improving the lymph flow, frequent urination and that kind of thing after the session would be
Should
quite
do, yeah.
big deal.
Yeah, a lot of, yeah. I mean, a lot of people do. They need to go to the loo afterwards.
How you feeling, Tori?
She's probably feeling, what's she doing, you know?
Yeah, it doesn't feel like much.
Like you're
at all.
doing anything, yeah.
No, it doesn't, to be fair.
Yeah. And this is a little bit of the frustrating thing, is because people are like, well, what are you doing? Okay, so just get you to chicken wing your arms out a little bit, and just if you can lift this side here, this side of your body. Okay, so I'm just placing the head, underneath the kidney area. Okay, and then I'm just going to just relax it to there.
Squish all the fat together.
Have you had any side effects or any reason to stop during the treatment?
No.
How long are treatments normally?
An hour. Can't do a 30-minute one.
And the hour you still may not quite reach, like if they
Correct.
have a problem. So,
Yeah. But because we're working, opening up,
It'll get further each time possibly.
yeah, but that will still facilitate drainage from below. And normally, if I actually usually elevate the legs if I've got a couple of cushions, if they've got foot problems or lower leg problems, just to for the gravity.
Could you do this for someone going through chemo? Or how long
Yeah.
post chemo?
Yeah, while going through chemo, not radiation, but chemo is fine. But again, the 3-day rule, because you want to let the chemo do its job, but the chemo can stay in the body for a long time. And I think that's, you know, where that smell comes from.
So when I smelled like metallic before, would that be?
Could you smell it?
No, you
Oh.
said you could.
Oh, yeah.
But would that be previous medication or?
Possibly, or just whatever. I mean, I've had that smell come out of me, and I haven't had chemo or anything like that. So
So it could just literally be a toxin your
Yeah,
body's produced.
exactly. How are we doing for time? Okay. Yeah. So I'll just get you to look it up there again. So when you've worked an area, you need to re-clear those nodes. So I'm just going to lift you up there. And if you can just bend those knees slightly again, just very slightly. So I'm just going into the iliac crest in here. You've got a bunch of nodes in through there.
If there's a lot of cleanup going on there with the macrophages and stuff like that, that's often quite tender in your. I always ask if, you know, do you feel anything through that?
And quite often this right side's a lot more tender for people than the left side.
And sort of said about the right side. Do you find the right side's often more congested than the
Yeah.
left? But, and go figure, why? Because it's only the head and the right side down around through there, that's the section that goes
Yeah.
into the right side.
But maybe it's people are right-handed or something. People are right-handed. I don't know.
And maybe it's the amount of vessels and stuff in the
Yeah.
head, like in the neck, through the, maybe, because that's the side that drains into the right side. It's interesting, we both find the same things.
Okay, so nice deep breath down to your tummy. And let it go. I usually find I'm breathing with the person as well. Okay, make sure I don't trip over myself.
And I can feel that more now.
Can you?
Yeah.
Okay. Can you hear that when I come?
It's just going a bit louder.
See how slow she's going through creating that rhythm.
Dawn's a fast girl, I'm the slow girl.
I'm just telling you, that's exactly right. I'm too quick.
Okay, and you've got a bunch of lymph nodes up through here as well. So where is she? For your mum, so you've got pathways up through here, around the side, through the back that you can use. You've got the parasternal nodes up through here as well. So there's a lot of areas that you can work, as well as the axilla, even though she's had the nodes removed. There may be one there.
Yeah, I'd say, well, she's had some taken from her groin and put in there,
Yeah.
so they'll be connecting
Yes.
slowly, but
Yeah.
somehow.
Yeah. How long ago did she have that?
6 months-ish.
Okay.
They said to take
has-
a year and a half for it to start
okay.
connecting up properly.
So that's that raglan sleeve talked about.
Yeah, rather than working one side.
That's hot, eh? It's warmer.
Is it? I don't know.
You're telling the story.
Yeah.
I am telling the story. Oh, right, felt warmer just then.
So you just, when you finish there, you go back in the
Yeah,
same
she had to-
step,
yeah.
steps you did
Clear it
before.
all again.
So you're building back up into it, and then always finishing at the turns.
I mean, even though I can feel bits and pieces and stuff, but it doesn't feel like you're doing much. It is actually quite nice just to lie down and do nothing.
Yeah.
I'm gonna say that's quite nice.
Actually, so I had a new client last week, and she arrived. Basically, she saw me and she cried. She's just going through a whole lot of personal stuff, and like really traumatic. And she said to me during the treatment, she said, I I'm so relaxed because I did her face to start. So she had leg issues, so I actually went back and did her face to start with because that's kind of how I thought I should do it because of what was going on with her. And she said, oh, this is so good. I feel really, really relaxed. I hadn't even thought of anything else, you know, like all of this trauma that she was going through. So to me, you know, that's good in itself. Yeah. So you're working with your parasympathetic nervous system. So if we're in a treatment room, you know, obviously I'd have the music going, it'd be darker and you wouldn't have everyone staring at you and, and all of that kind of stuff, you know, so it'd be a lot more relaxing treatment.
Do people fall asleep?
Yes they do. Not a lot. And, you know, people talk too much sometimes through the treatment as well, which is not ideal. There you go, Tori.
Thank you.
So, please make sure you have adequate water today. And
Probably stop